This is your vagus nerve, and today I'm about to do an Instagram live with Brendon Talbot all about the vagus nerve and how it may be impacting us in ways that we don't understand. So I'm inviting him right now. It all comes down to this little nerve right here, which just fell off my skeleton. So here's Brendon. How's it going, Brendon?
Hey Joe, how's it going? Good. How are you?
Very good. Um, I'm glad we finally made this happen. We've been talking a lot through Instagram for I feel like a year or two. And
Long overdue.
we finally decided to actually collaborate on something that helps both of our patients, and which is the vagus nerve and the sympathetic nervous system, the parasympathetic nervous system. So why don't I kind of start off with you? Can you just kind of introduce yourself, like what you do, where you're from, and all that?
Yeah, so my name is Brendon Talbot, as Joe introduced. I'm from Toronto and I'm a manual osteopathic practitioner. Learning and working with the body has been a part of my life since I was a small kid. Sports took up a big part of my life. I've played many different sports at a high level, and I think that kind of pushed my interest into learning more about the body, how to maximize and get the most out of each situation, whether it's building muscle, becoming more athletic, having quicker recovery. And I found myself uh, in into movement science and kinesiology in university. And I never really wanted to be a kinesiologist, but I just knew that that would be a good gateway into something that I wanted to do. And I found osteopathy, which I feel like is a perfect profession for me based on the fact that it is a holistic approach and looks at the entire body and tries to figure out what's going on from a collective perspective, meaning bringing all of the layers and functions into every situation and trying to make the most sense of it. So I've been a manual osteopath now for about 6 years. And in the last 6 years, I've been working on my social media presence where I've built a following over 3 million followers across platforms, just teaching people about the human body. And just like yourself, which is one thing I want to get into and I really appreciate, it's very difficult to find ways to simplify this stuff because the body is the most complex thing there ever ever.
Yeah,
And it's very difficult to take these concepts and simplify them, but you do a very good job. And I appreciate that, and I'm sure many other people do.
thank you.
But it's been nice, and now with social media and situations like this, we can communicate with people around the world, learn from each other, teach people in a setting like this. So yeah, so I'm excited for today's talk.
Yeah, me too. Yeah, thank you. It's, when you get that bug to study the body and understand it, like it hit me young, and then it just starts just compounding and compounding, and it's wild. And so today we're going to talk about the vagus nerve, and really, it's kind of like a trendy topic. People throw it around all the time, and what we want to do is get into the science of it and really, um, just to very simply put it, like the nerves in our body are what control, our hormones, our muscles, our joints, our organs, the way everything works together. And the vagus nerve, one of its primary responsibilities is to keep us more in a calmed, relaxed, ongoing state. It's not something, we have two systems in our body. We have the sympathetic system, which ramps us up when we really, really need it. If we need to achieve something, if it's fight or flight, if we're in an emergency, it ramps things up. And then parasympathetic is just what allows us to function at our maximal, most efficient, effective, streamlined processes at all times. It's kind of like the sympathetic system is the sprinter, and the parasympathetic is the marathon runner or the walker. And it just keeps us in a state. And the more that, the better that we can be activated in that parasympathetic ongoing state, the more that we can have like a longer volume and a longevity of healthy normal function. And the vagus nerve is one of those nerves that is primarily responsible for keeping us in that state. And so if I could just kick it over to you, if you can kind of just break down, maybe just start with like what it is, and then like a couple of the ways that it impacts, people who are really like in pain or feel like they're not functioning normally.
Yeah, I mean, the vagus nerve, we could probably talk about this for an entire day, but we'll try to talk about the main concepts today and simplify things so that people can get the most out of understanding this nerve and its functions and its importance in the body. Now, one issue I kind of have with a lot of like medical testing and stuff, it's very rare that doctors will test vagus nerve function. Now
Mm,
that might come down to technology, having the ability to kind of test its fibers and whatnot. But a lot of things that I see come into my office, autonomic dysfunction or let's say vagus nerve dysfunction, it's very hard for somebody to know that their vagus nerve is dysfunctional. Somebody might have digestive issues, somebody might have um, dizziness or vertigo or ringing in the ears or the inability to rest or sleep. So, sleep issues, um, chronic inflammation. These things show up as symptoms, and people understand that those symptoms are there. They might be swollen all the time, or they might have a full night's sleep and not feel fully rested. Um, but I find it's very rare that somebody links that to what's happening with their nervous system, and maybe even understanding that their nervous system might be stuck in a sympathetic state. And a lot of society nowadays kind of pushes that sympathetic state, especially jobs, finances, everything is just go, 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 go. I actually just got back from Europe. I just spent 3 weeks in Europe on my honeymoon. And life there is just,
congrats.
thank you, appreciate it. Life there is just a little different in the sense that people are a little bit more relaxed. It's more involved with nature, I find. I'm in the city, so we don't really get a lot of that nature time spent in nature, time to reset. It's always just go, 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 busy, busy, busy. And and this keeps the sympathetic nervous system and the stress response on alert at all times. And just like having your bicep contracted all day, it let's use muscles for example. The bicep and the tricep, they're opposite muscles. So in order to contract the bicep, the tricep has to relax. If the tricep is contracted, we can't contract the bicep. So
Mm,
just like with the nervous system, if the sympathetic nervous system is always activated, the parasympathetic nervous system doesn't really have a chance to be activated or do its proper functions.
mm,
And the parasympathetic nervous system has a lot of major roles in the body. And when we talk about the vagus nerve, it affects things like heart rate, blood pressure, breathing rhythm, digestion, inflammation. So a lot of these main functions in the body rely on proper vagus nerve function.
mm,
Um, yeah, and the other interesting thing with the vagus nerve is it carries both motor and sensory fibers. So this is important to know because certain nerves in the body are only sensory and some nerves are only motor. But the vagus nerve actually has both pathways. And this is why what is happening on the external frame, so muscle tension, tight fascia, these kinds of things send feedback into the nervous system and can alternatively alter the function of the vagus nerve as well. So I'm sure we'll dive a little bit more into that as well.
mm. So, you touch on like inflammation, and even the musculoskeletal system. I think those are, a lot of people on the stream are people who are in pain or having persisting symptoms. Like you said, if it's not described as pain, it might feel like brain fog, pressure, ear symptoms, ringing, like tension. So if we're going to just go to inflammation and then we're going to go to the actual musculoskeletal system, um, how does it impact? Can you just tell us about its role and how it impacts inflammation?
Like the vagus nerve specifically, or stress, or tension, or
I
pain.
I guess if we're going to use the vagus nerve as the main driver of what we're trying to stimulate, I understand that. I think a point that I think you would probably want to make is that we're not, all of our actions are not just impacting the vagus nerve. There's a lot of nerves that impact these parasympathetic, more healthy, ongoing, long-term processes in our body. So if we're going to talk about, I guess, just the nervous system, with the understanding that the vagus nerve is one of the drivers of it, how does this impact nervous system function, inflammation in our body? And then what can we do about it?
Okay, well, first, it's important to understand what inflammation is. And a lot of people fear inflammation because they think it's a bad thing. Now, in the short term, inflammation is actually a positive response of the body, and it's basically the body's immune response to perceived threats. So, um, when the body experiences a threat, whether it's toxins, bacteria, stress, the immune system basically releases a response to help clear that out and bring the body back to homeostasis. Now, the problem is if we have chronic inflammation where the body is continuously exposed to triggers without having those triggers resolved, then this is where you have chronic inflammation, and chronic inflammation becomes problematic. Think of it as I always try to use analogies in my practice, but basically, um, you have a garbage bin and you fill the garbage bin with garbage, and that's fine. But when the garbage bag gets full, you usually replace it. But if you did not have the ability to replace that garbage bin and you continuously still had garbage because you eat every day and you use things every day, then the garbage bin would eventually overflow. And one of the analogies I use in terms of how toxins can then start to affect other areas of the body is if you took that garbage bag, let's say, and threw it in the garbage chute, and everybody, in a condo threw their garbage in the garbage chute, but nobody came at the end of the week to clean that garbage chute out, the garbage would eventually pile up and that garbage would start to smell. And even though you're in your condo and the garbage room is down the hall, the smell from that garbage room would eventually start to affect all of the people living on that floor and eventually in the entire building. So in the body, if you have one area, and let's talk about the vagus nerve, like let's say the superior thoracic outlet, if you have one major drainage area that's blocked, restricted, dysfunctional, it can create backup and blockages kind of elsewhere in the body as well. And the vagus nerve becomes a big player in this because the vagus nerve starts in the brainstem and goes all the way down to the digestive area. So a large chunk of your body is being impacted. Sorry, a large part of your body affects the vagus nerve. So you need proper function in all of
Mm,
these
mm,
areas to have good functioning vagus nerve. You could have diaphragm dysfunction, and that'll
yeah.
negatively affect the vagus nerve. You could have TMJ dysfunction that can negatively affect the vagus nerve. You could have cervical spine dysfunction that could affect the vagus nerve. It's not like the nerve just comes out of one segment and
Yeah.
goes, to one part of the body. It's a pretty big area.
Yeah, all the way out to the ears and all the way down, like you said, and through to the organs. And I think like it's such an important concept to understand that it's not black and white when it comes to our nervous system, just for lack of a better term, the body. Musculoskeletal system's a big word, but like give your body and your nervous system. If your body is sending this, you know, everything is about signaling, interpretations of signals. So if your body, whether it's organs, muscles, joints, other receptors, they just send a signal to the brain that says, hey, this is the situation. It doesn't tell the brain pain. It doesn't tell the brain like speed up. It doesn't tell the brain pressure, or it doesn't tell the brain how you should feel. It just sends signals. And then the brain takes those signals and say like, should we be worried about this? Oh yeah, okay, make them feel pain so that like they know to move. Or like, hey, make the heart rate speed up so that it knows it can do its job. It is interpreting the signals. Whereas if you stub your toe, but you're in the middle of something really important and your brain sees that signal, it's going to say, it's not even worth giving them pain because they're doing something much more important now. Like, he's giving a speech. So don't make him fall on the ground and grab his toe. You won't experience pain. So it's always prioritizing and deciding what you should feel. And then it decides what you feel. So if your body is in dysfunction, it's constantly sending signals up to your brain and your nervous system to act a certain way. So even if your nervous system was healthy to begin with, if your body keeps sending these same signals over and over because there's dysfunction in there, it's going to change the way the brain and the nervous system acts. Likewise, if your body gets to a point where it's fine and it's functioning normally, but the brain and the nervous system is dysfunctional, it's going to send signals to the body, and now the body's going to get dysfunctional. And it's a loop. And if you're not working on both sides, you can get caught in that fight or flight response. And like you said, so many things can trigger it, but a very simplistic view that I look at it is that even if someone doesn't have past traumas, issues from growing up, relationship problems, things that are actually impacting their ability to regulate their emotional state, if they just have a new issue, a new pain, and they actually just start worrying about it because it's not going away, that can then send them into that fight or flight sympathetic response constantly. And so like we have to constantly be working like always in science, as you know, this is one of the first things I realized as I was going through it, because you would get questions on tests and sometimes I'd be like, ah, it's all of these answers. But the body and the brain doesn't really care about all the answers. It just wants to know like what's the biggest lever that I can pull to make a change on my state. And if it really is a dysfunction in a part of your jaw or neck or some other part of your body, then you go for that. But if it is something to do, like you're saying about like the gut or toxins or you're in a dysfunctional relationship, that's the biggest lever to pull. And I think that as practitioners and as people, our the biggest mission we're always on is figuring out like what is that lever so I don't spend 2 years working on
Yes.
the wrong thing.
I think that's a very, very important point, especially with what we do in terms of like manual treatment,
Yeah.
because everything is connected and you can't treat everything all the time or all at once. You kind of have to find that main lever to at least get the ball rolling. And you kind of touched on feedback loops where one thing affects one thing, but then that also negatively affects that, and it kind of creates this negative feedback loop. The same is also true for positive feedback loops. So if you find that big lever and you start making improvements to it, it can start to help that issue, which then can lessen the psychological stress, which then can also help that issue. And it, you know,
Mm.
there's an aspect of education with patients. I think if patients can better understand what's happening and they realize that it's not as big of a threat as they might have perceived it when they didn't know what was going on, I think that has such a tremendous positive effect on people healing and getting better. A lot of people that I see in pain, let's say people with chronic pain, they almost kind of go to the worst case scenario. They might
Mm.
Google it and all of a sudden they think they have cancer or they're going to die in 5 years or it's something so far fetched than what is actually going on. And when
Mm-hmm.
you run through your assessment and you realize, this isn't as bad as they may think, that gives people hope. And I think that little seed of hope also can modify and help with the pain response,
Yeah.
which
Yeah.
is pretty cool.
Yeah. I think that there's a role, at least I'll speak for myself. I'm always working on people and talking about, root cause and figuring out, again, root cause really is the biggest lever because there's always multiple things going on. So there's never one. But
Right.
again, you could also just call that the biggest lever. That's your long-term fix. But there short-term relief strategies, there's also a role for that because yes, I see people who are doing short-term strategies, which they've now started to use for long-term strategies, and that's where they're really in that loop of like, this never gets better. It's better for a day
Right.
worse. It's like you're taking a short-term strategy and you're trying to use it as a long-term strategy. But sometimes for the long-term strategies to work, you need to get your nervous system, your body into a state that's ready to accept the longer-term strategy. And the way that you do that is with short-term strategies. Rubbing on something, putting heat on something, relaxing, just doing some simple breathing techniques. Like that's not going to pan out to fix the whole problem, but like use that to get into a better state. Quick wins, like as providers, we know like first couple of visits, get them quick wins. Let them feel encouraged and get their body to be in a happier state. And then you do the long term work. So like there's such an important role of both and understanding like when to begin one, but then when have you relied on it for too long and when do you transition to the next thing? Because usually when you get into the longer term fixes, there's going to be flare ups and triggers and you're going to trigger the wrong thing. But like that's a process you have to go through. And so the short term helps, I think, people to kind of get through that.
Yeah, I again trying to relate things, in an analogy.
Yeah.
If you're trying to get into exercise or sport, you always practice a simple skill first. But the
Hmm.
simple skill isn't the whole picture. It's the
Hmm.
skill to get you to the next level, to get you to do a more compound movement or compound exercise. And one thing like a lot in my treatments, if I'm trying to make spinal changes to the actual spine. So
Uh-huh.
let's say spinal joints, or let's say changes to sensory input around the spinal cord. I personally work through the layers. So I'll start on the most superficial layer and kind of work my way through. So whether it's starting with the fascia or the neuromuscular layer before trying to work on that articular layer. Because like you said,
Okay.
usually things don't kind of work in isolation. Usually things work collectively. So if you
Yes.
have a segment in the spine, let's just say T1 to T4. Usually, if those joints aren't moving, it's going to
Mm-hmm.
negatively affect the muscles that attach to those joints. Because if the joint can't move, then the muscles can't be doing what they want to be doing. And
Right.
if the muscles aren't doing what they're supposed to be doing, then the fascia and the soft tissue around there is also not doing what it's supposed to be doing.
Right.
And the lack of joint movement is probably the most obvious. Like if you tell someone, to turn their neck and they can't turn their head independent of their thoracic spine and they start to move, their whole upper body, you already
Yeah.
know that there's dysfunction in those segmental joints. But for me, in order to kind of get into that area, I will work on the superficial tissues first to soften those up, get those working a little better, so that when I'm at the joint segments, I don't have as much restriction around the
Mm-hmm.
area. And
Right.
I find the deeper you work into the body, the more, how can I put this? The more intense, I guess, it is on the nervous system. So if somebody's
Mm-hmm.
really dysfunctional, you don't want to just go in and like kind of spark this whole effect where the body kind of goes into protective mode. I think it's very
Mm-hmm.
beneficial to kind of work gently
Yeah.
in, let the body feel safe. You're making change, it's small change, but like you said, you're making small wins to get to the bigger picture. But you have
Yeah.
to kind of know the process, I think, too, right?
Yeah, and and there needs to be like a plus or minus of like 20%. Like what's that stress level? Like if you want to, if you're feeling aggressive one day and you want to go for it with the client, like you go up 10,
You have
20%,
to know
but
when they can handle it.
yeah, you can't go past that. When we were talking, before we went on, you had a nice breakdown of how the nervous system like actually creates like muscle pain or how the vagus nerve and not being able to um I'm just wondering, like, when we talk about, can you just briefly touch on your body goes into this fight or flight response, like, just like very high level, how the parasympathetic kicks you out of that? And
Yeah,
then and
yeah,
then
yeah.
also and I think another thing would be like how muscle pain can be caused because of not being able to get that vagus nerve to fire
Yeah,
because of the
yeah.
parasympathetic system.
I'll try to explain it
Yeah.
to the best of my ability. So basically, there's cells within muscles, um, within the muscle fibers themselves, and at the ends of muscle in the tendons. So in the tendons, there's these cells called Golgi tendon, and within the muscle belly, there's cells called muscle spindles. And basically, the Golgi tendons protect a muscle from lengthening too far where the muscle will actually tear. So they're like security guards at the ends of muscles where they tell the muscle and the nervous system when to basically contract. So if a muscle is stretching too far
Mm-hmm.
and it has the potential to become damaged, these Golgi tendon fibers will
Yeah.
signal to the nervous system to contract that muscle to protect it. Now, this is very interesting. If somebody doesn't have good joint movement, those cells will trigger a lot quicker. So if you have good joint movement and a joint can move relatively well, a muscle will have a greater opportunity of lengthening or of stretch. So some people say, my muscles are always tight. And no matter how much I stretch them, they're still
Yeah.
tight. It might not actually be the muscle that's the problem. It might actually be the joints that the muscle is attached to that aren't moving properly, and that's keeping that muscle tight.
Mm-hmm.
The muscle spindles sense stretch as well. So rate of stretch, like how quickly something stretches. But when your body is in a sympathetic state, this heightens the sensitivity of these cells, which means basically the the muscle spindle sensitivity increases, which makes the muscles hypersensitive to stretch.
Right.
So they're a lot.
I think we just lost your audio for a second there.
Oh, is it
Yeah,
back?
it's good. That's perfect. Perfect.
I got the signal that my battery was at 20%.
Oh, okay.
What did you hear? What did you miss?
So just that the muscle spindle becomes more sensitive, and what that means is,
Ah, it make it's going to increase tone and reduce flexibility. So basically, it's
right,
going to keep the muscle in like more of like a rigid state.
right.
and and the parasympathetic nervous system, when it gets activated in a lot of the fibers through the vagus nerve, this helps relax muscles and helps muscles get back to resting state. But if the
Mm,
body is always in a fight or flight, the body wants to be tense, it wants to be primed to survive, basically.
mm-hmm, mm-hmm.
But we don't, a lot of the stressors that we deal with on a day-to-day basis are not for survival. They're just day-to-day stressors. But the nervous system doesn't know the difference.
Right. So
So this,
it doesn't understand. Yeah, right. It doesn't fully understand why. So now you have this ongoing tension. That's all part of it. So
so you're gonna have
being,
like the body guarding and a
yeah,
lot of like spasms and muscle tension. Yeah.
yeah. So everyone knows fight or flight. Fight or flight keeps you in that response where it's just like you're emotionally revved up, like your heart rate's up, your blood pressure's up, your muscles are tense. And the vagus nerve and the other system is the parasympathetic system. It just turns that down and it keeps you in that state where you can just have a conversation and relax and, enjoy a cup of coffee, hanging out with your friends, like just, that system. And the negative effects of being able to trigger that are some of the things we talked about. Your muscles feel achy, even your digestive system is off. There's more inflammation in your body, so you can't heal as well. So you feel brain fog, so the joints are more, um, it could be more achy, or the muscles you can't heal as well. And I think that's where people start feeling like I'm always tired, my muscles always kind of hurt, like there's pain going on. They look at other people, they're like, how come their injuries healed but mine didn't? Like it might not be a musculoskeletal joint and muscle problem, it's the nervous system state you're in. So just to kind of do like a little recap of that. So when it comes to actual strategies, I think we have a bunch we can choose from, but I have a little list here just that came from both of us. When it comes to breath work, how have you found it like a way for people to implement it? Like people who are watching, like what's an effective way to implement breath work?
So breath work is an interesting topic all in all because we can breathe in different ways. We can breathe really quickly. We can breathe slowly. We
Hmm.
can do a shorter inhale, longer exhale, shorter exhale, longer inhale. There's different variations that we can use when it comes to breathing. And all of these different types of breathing will affect the nervous system slightly different. Um, when we breathe, the ribs should expand, the diaphragm should come down, the lungs should fill with air. You, I'm sure you know this, but even if you have your hand on someone's low back and they take a deep breath, you can feel that movement. So it's not
Hmm.
just the rib cage that moves, it's
Yeah.
the entire body, right? And we're changing fluid pressure gradients. And I think something that's not talked about a lot is blood flow and circulation.
Hmm.
Um, the other thing too, I just kind of want to go back a little bit and talk about tight muscles. When muscles are tight and chronically tight, this
Hmm.
completely restricts circulation. And this is
Hmm.
problematic for a few reasons. One, your body cannot get rid of toxins very well. So when muscles are tight, it's going to put a lot of pressure on the blood vessels. It's going to compress lymph.
Hmm.
So the body's not going to be able to cleanse as quickly, which means slower recovery. Especially after exercise, when you have lactic acid buildup, you want that stuff to kind of circulate relatively quick, and you want fresh, healthy blood to go to the tissues. And if you have an area that's restricted, I use like traffic a lot for explaining blood flow. If you have an accident on the highway, it doesn't matter the importance of you having to get to that meeting downtown in 20 minutes. If that accident is on the highway, you can't get there.
Yeah.
It blocks you. So if hormones need to go to certain organs at a specific time, like let's say you eat some food and you need to digest, but blood cannot get to your digestive organs, you're not going to digest that food very well. And that process needs to happen at that moment. So it's very important that fluids can circulate well through the body. And breathing, a lot of people don't really focus on breath work, and a lot of people aren't really even aware of doing things like breath work. So our resting breathing rate is very shallow. When we're just here breathing normally, our rib cage is not moving very much. Your
Hmm.
lungs are filling a little bit, you know,
Right.
exhaling, inhaling, exhaling. You're not really getting a lot of movement that you would if you were to consciously
Forced inspire. Yeah.
take a deep breath. So everybody on this live, I want you just to try this right now. Just take a really deep breath and put your hand anywhere on your rib cage. You can start at the top, you can start at the middle, you can start at the bottom, and you can do all three if you want. And just take a really deep breath and see if you feel the ribs moving. A lot of people have restriction in their upper rib cage. They move more kind of through the bottom of the rib cage.
Hmm.
But however, the ribs, your first rib is up here and your 12th rib is quite low in the body. So the rib cage is actually quite big.
Yeah.
I'll pull this guy over here for a second. I don't know if you can see him.
Yeah,
Yeah,
yeah. Very
but
well.
the rib cage, it's a pretty big area. So all of these ribs should expand when you take a deep breath. If you notice that like any part of the rib cage is not expanding, then that could, be a signal that there's some sort of
Restriction.
musculoskeletal or restriction, dysfunction in that area. But the circulation in the area that's not moving very well is going to be compromised. So breathing and different breathing things that we can kind of use to activate the parasympathetic nervous system are going to be a little bit more of the slower breaths. So kind
Hmm.
of full expansion, slower on the exhale usually tends to work a little bit better
Then the inhale.
than the inhale. You can kind of do like, let's say, maybe like a 4 second inhale and an 8 second exhale.
Yep.
Or Huberman talks a lot about like the double inhale with the long
Yep.
exhale. They're,
Yeah.
yeah, like kind of
Oh, the yes. Yep.
like that one tends to work really well. And this has been, this isn't hypothetical. These have been studied and proved, and they've checked heart rate and they've watched heart rate and blood pressure
Chain.
instantly decrease and change with breath
Yeah.
work. So it's extremely powerful. And I think a lot of the things when it comes to improving our health and wellness, we overthink the simplicity of it. The simple
Yeah.
things tend to work the best, to be honest.
Yeah.
Everybody's
Oh,
looking for the
yes.
more complex, what the more complex movement or exercise. Like
Yes.
what's a harder variation I can do? It's not about doing the harder stuff. It's about doing the stuff that works more consistently.
Yes. I completely agree. It's it goes back to like figuring out like the biggest thing that you can do, and it's like it's fundamentals. People, sometimes people are like, I stay up late, I watch TV really late, I don't get a lot of sleep, I eat late, I don't really exercise, I'm constantly on my phone, and they're like, I'm feeling anxious and my body doesn't feel right, like, so I'm gonna like, I'm convinced there's something like horribly wrong with me. I'm gonna do these in-depth blood panels and I need to figure out what's going on, and it's like, the answer might be just hitting you right in the face. Like, fix the sleep, get some exercise, try to change your habits a little. You can do that all for free and you can start right now and then see what happens. There's not always, this obscure, hard to identify, ominous problem. A lot of the times it's just like the straightforward habits, which I know can be the hardest things because that you
Mm-hmm.
have to put energy into that. It's a lot easier to find a result from a test and find like this is the supplement or the medication and then this is going to help. Yeah, that's easier. But when you have to actually change the way your brain and your nervous system think, it takes repetition. Like just like an athlete to become Tiger Woods, how many times you need to swing the golf club to like have this perfect pattern? It takes time to change the way your body functions too with repetition. That's what the body is all about. Like whatever the highest amount of repetition it gets from whichever piece of your life, like that's the way it starts like acting and that's the what it absorbs. So it really is just a habit and volume game.
That's an
Um
interesting thing with chronic pain because
yeah,
the body starts to get used to the pain and it actually starts to become good at being in pain.
yes. Yeah, it
It,
gets
it
good and
becomes the
remember
default.
and relies on it and it almost becomes like a source of like a comfort in terms of not the way you feel, but it's just your body's always looking to conserve energy and to do what it knows. So when you tell it like you're not a chronic pain person, like you're gonna think differently about this, you're gonna focus on different actions. It sees it as an unknown, it makes it
Yeah.
anxious. And then it's like I'll just stick to this, and that is a piece of it. No pain is made up. Everyone who's suffering like pain is real, but it just comes down to like again, what are the drivers of it? What about like we hear a lot about, and I use this with people as well, gargling and humming. But like, what part of like when it, I don't know if you've used like chanting and singing, gargling, humming.
Yeah, that can be
Um,
helpful.
yeah, and like the part, there's different. I think it would be good to touch on the different parts of the vagus nerve, like the laryngeal or just vocal portion of it, where all of those throat ones are coming from. Whereas you have like some of the ear ones, like the Simba concha, how there's an auricular branch, which basically auricular means ear, branch to the vagus nerve, so you can stimulate it there. Do you try any of those?
Yeah. In terms of like if I was working with a patient to try to improve this situation, The first step for me is making sure that their body is functional. So I would really work on like the cervical spine and all the soft tissues around the neck, the
Hmm.
diaphragm, the ribs. But once that's moving, then you can start to activate the vagus nerve via these pathways. And the vagus nerve is very deep within the body. It's not superficial, but there are a lot of branches off of the vagus nerve that come to these superficial areas, the ear, even like just on the inside of the SCM through the carotid sheath, the
Hmm.
laryngeal branch. Um, so to your point, chanting, humming, singing, those vibrations basically stimulate those branches of the vagus nerve. So it actually can increase the tone. And when we talk about tone of nerves, so just like muscles, people say, I want to be toned. So they grab really light weights and they do 1,000 repetitions. A lot of people kind of understand that that will, let's say, tone a muscle. But just like you said, it's about the repetitions. So if you just hum or gargle once or once a
Yeah.
month or, and say it didn't work, my nervous system isn't fixed. Well, of course not. If you're in a state of stress every hour of every day, technically you need to be doing these things more than that every half hour of every day to override
Yes.
the response, right? So
Yeah. 100%.
it's exactly what you said. Whatever your body is experiencing more of, your body will be in that state. So if you want to improve your vagus nerve function and make it work a little bit better and have those positive beneficial effects of the vagus nerve, then you need to be working on being in that state and stimulating it and doing these things more than you're in the state of stress and overwhelm.
Yeah. And I think that's another like piece, not to just be talking broadly, but your brain, your nervous system, it's an electric flow. And so the more ways it gets stimulated in a certain way, that area just becomes activated. I think about it like when I go home at night, my wife, she's home with the kids. I'm working here. When we get home, after we're done with the kids stuff, all she can think about is like the kids need this and this and that, and all I can talk about is like in the business today we did this and this. Why is that? It's because we're constantly just niched into specific parts of the group of like what our common goal is, and so that's just the way our brains are functioning. And like the more you expose it to something, the more like it starts replaying that. And I even think about like when I work with people, I always tell them I could give you the perfect, or if you receive the perfect 20 to 30-minute routine um, to like fix whatever pain you're experiencing, and you did it every single morning, that's never going to compete then compared to if I gave you a 60-second strategy that you did 8 to 10 times a day. It would actually take half the time, but it's sprinkled out because life is just mentally, lifestyle, physically positioning. It's just driving you, just doing what it wants with you. And you need to constantly just reset, reset. And then it's a fight that you slowly win. And it sounds like a lot, but once you get a week into this and you start gaining some momentum and it starts becoming the new norm, the hardest piece really is just getting started.
It is. And I think for a lot of people, it's knowing.
Hmm. Audio again.
Sorry.
Here we go. You're good. You're good.
The first step is knowing, like understanding that there is a nervous system, understanding how the nervous system works, that it's all signaling, understanding that it can change over time. I think people kind of need that base, right? Like they need to know that it's possible because even without that knowledge, they're not even going to be thinking about doing any of these things. But once you know and you have some tools that work, specific types of breath work, stimulating certain parts of your body to trigger this nerve and turn it on basically is, for layman's sake, um, and down regulating a lot of the other things like the overwhelming thoughts and stressing about things that don't really matter and changing how you perceive the world. If you perceive the world in a very scared, threatened way,
Hmm.
maybe you had a specific trauma that really, really affected you, or, maybe you got in a car accident and now every time you think about getting in a car, it re-triggers that response. That is going to have a drastic effect. Like if you are doing these nervous system techniques, like you said, 60 seconds a day, but then you have something that like kind of blows it out of the water, like a major trauma that gets re-triggered, it really does undo a lot of that. So it is quite difficult to kind of get over that, but you have to kind of also shift your mentality around that that traumatic trigger as well. That's another fact of it, like down regulating that so that these things can have more of an effect on your
Hmm.
nervous system.
Yeah.
Um, that plays a big role too. And like you said, the vagus nerve starts in the brain. So how we think plays a massive role on how the signaling is being sent throughout the body. And it's really interesting. If you're really hungry and you see a photo of food that looks really good, you'll notice you'll start salivating. Like
Hmm.
your thought can literally create
Yeah.
physiological changes.
Or
We know that.
or goosebumps.
Exactly. Like that's just
Yeah.
a thought. Or like something, you feel like, oh, I just heard something so sickening and you just have like this pit in your stomach.
Hmm.
That's a thought triggering a response
Yes.
in the body.
Yeah. Yeah, so I think you need to add in the new strategies that you're going to use, but also know how to manage the
Yeah.
triggers that are actually like driving you into a sympathetic fight or flight response. Like it is definitely both. And something I use with people is kind of going towards the pain. Just like anything else in life, when you're trying to learn something, you're trying to overcome something, you're at a tough point in your life, you have to, in the beginning, you might ignore it or you might avoid it. But like ultimately, you get to a point where you realize this isn't changing, this is getting worse. Or you're like, all right, I guess I'm actually gonna have to like go head on with this and like understand it. Because when you don't
Hmm.
understand it, that drives fear. And so I
Yeah.
usually tell people, who I work with, it's like whatever the pain is, like we have to explore it. We can put speed bumps in the road. We don't need to go full speed on it. Like we can draw this out. But if we know something that constantly triggers pain for you, instead of getting away from it, we're going to actually go toward it. And we can
Yeah.
do it in a way where it's not going to trigger a lot. But listen,
Yeah.
it may trigger, and I'll apologize ahead of time. I may ruin 2 days in a row for you because we went a little too far. But like that's really how you learn it. You have to be able to, at some point, go toward it. And a lot of people, what happens is when you've just been suffering a little bit, like you're like, I don't need to figure this out. I don't need to go into it. I'll be fine. But then, like, and I see this pattern all the time. Then it's the people who are suffering 6 months, a year, multiple years, where they're like, all right, this is actually going to be something that I have to take on. Like, I got to find the right people to help me, but like, I actually have to figure this out.
Yeah.
It's never a passive, like, the people who come to you and they lay down and they're like, all right, fix me. And then, like, they do absolutely nothing on their own until next time they
Oh,
see you. And
I try to break that pattern right away.
yeah, exactly. It
Because
doesn't work.
ultimately their health is on them. Ultimately,
Right. Yeah.
it's not up to us. We're there to be like the guide and to help them get through that. And I think what you just said is a very, very, very valuable point in terms of like moving towards that pain point or that threshold. And you want to increase the threshold. Like you don't want that threshold to always stay there and get
Hmm.
triggered every time that person gets to that threshold.
Yes.
You want to slowly push that threshold so now they have more room to deal with these certain things and not have that same trigger.
Yes, absolutely. Fully agree with that because you're giving them more space,
Yeah.
basically, to
And then they
live.
can exactly, and then they're not going to be triggered like with just these little,
Mm.
nuances. Now it's going to take a lot more to trigger it, which gives them more freedom and flexibility with their life.
So just to kind of bring this conversation full circle and like actionable, I guess, for people watching. And I saw a question about how it impacts digestion as well. So like even like irritable bowel syndrome. Whereas in the past, we may have thought that it was just a problem with the gut or the intestines. Because we know the nervous system directly impacts that, just the stress of being in that state can actually change your bowels. And again, it could be like you could be running all the blood tests and parasite tests and everything and trying to figure out like if there's something wrong in there when really it could just be that the nervous system is dysregulating it. Do you have anything on that?
Yeah, I mean, when you're in a sympathetic state, so again, that stress state, the body is not prioritizing digestion. If you're trying to survive, just think about running from a lion. Your body is not trying to digest food in that state. It's trying to keep you alive and it sends the blood to specific muscles to allow you to flee.
Hmm.
So in digestion, you're going to have slower motility, which means the food is going to move through your digestive system a lot slower. Your nervous system reduces the amount of enzymes being released in your digestive tract, which is going to slow down the actual absorption rate of a lot of the nutrients and stuff that your body needs. So food will end up passing through the nervous system, not being absorbed as well. Um, and this can lead to things like bloating, acid reflux, constipation. Um, but the you need this secretion of certain enzymes and elements within the digestive tract to help it work properly. And if it's not functioning properly, it's going to send a signal to the body that there's a problem, which is going to then trigger an inflammatory response. And if you don't have proper circulation going to the digestive tract, but you have an inflammatory response, it creates all sorts of negative issues because now
Mm-hmm.
you have inflammation, but the inflammation can't drain out of the area. So then it starts to build up. And then if you're not recovering by the time you have your next meal and you're still in that state, it's going to compound and eventually lead to more chronic conditions that, can't really be understood.
Mm-hmm. I love that. That's such a great breakdown of it. Um, and I think so many people are probably confused by digestive issues. And I think like what we were saying, like start with the basic stuff. Start with the basic things that you can control, which is movement and mindset and retraining the way that you activate your system before, if you're really looking for like, where do I start? You start with that, and then you can go to the more like nuanced, complicated,
Exactly.
more expensive um, issues
Well,
or
and a lot of those things
strategies.
actually get better when you start to work on the bigger picture too.
Right, right. So, just to wrap it up here, because this has been amazing, let's just kind of fire off, like, in conclusion, what are some great strategies to impact the vagus nerve? I know, I think that one thing we've got across pretty well in this is that it's so much more than just the vagus nerve. It's it's the nervous system, and but let's just say for the vagus nerve to get it to work better, what would you say are some strategies um, that we've touched on throughout this? So we talked about breath work, and then like basically the take home that I had from that is, um, it's slow, controlled, deep breathing with the longer piece of it on the exhale.
Yep.
Um, what's another one that you would throw out there that you found is a good way for someone
Um,
to start today?
very, 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 like honestly, super simple. Just go for walks, daily walks. Like that's like the most simple one. But I think a lot of people overlook that. Movement is just going to help with circulation. It's going to decrease the amount of stress within the body. So that in itself can help improve vagal tone. Like you said, humming, chanting, singing, gargling. You can do this for, 30 to 60 seconds a day, or whether it's in
Yeah.
the morning or at night, just put some water in your mouth, gargle with it,
And
30
just
seconds.
one thing on that, I usually tell people with that, it's something you can practice throughout the day. But those ones are really good if you feel yourself about to encounter a trigger for you, or if you feel that you've entered that state of fight or flight and you're starting to ramp up.
Hmm.
Those are great strategies to nip it in the bud because you can do them for a minute. Maybe you could do a couple minute long session. You do some long bout as long as you can hum for a breath and
Yeah,
then
yeah.
reset. Do it for a couple minutes. And even gargling is a real simple one. Get your water right next to you. Do some gargling. If you're not in an office, you can try singing and chanting.
Yeah.
But they're really great ways to just nip it in the bud and bring yourself back down. And then maybe at lunch or we have more time to actually go for a walk. Um, or even the breath work is a short one, but like I find that like the humming and gargling and is just a very quick way to get you out of that state. Again, kind
I
of
like
bring it
that too.
back to the short term to like hit it and then follow up with the long term, kind of how we started the conversation. Sorry, I cut you off.
No, it's okay. You were still talking. I like that too because that is actually going to switch people's thought process. So they're not going to be focusing on that trigger as much. And they're like, oh, I got to focus on like,
Yes.
so it actually takes their attention away from it. So that's like two
Well,
positives.
yes, because again, breaking out of these types of like some your nervous system can be sending you pain just because it's an available pathway that's easy to send the nerves down. So every time it starts going down that path, it's kind of like if you quickly built a dam and rerouted it, you're slowly can like for the long term weaken that. So it actually is like a long term strategy too, to your point.
Yeah, I like that a lot. I think lifestyle and nutrition is a big one. Um, Reducing your exposure to toxins. This one is simple, but not so simple at the same time. We're kind of, you know, I don't want to say screwed, but a lot of the foods are being
Yeah.
sprayed with things, and we can't always avoid that. But things in your household, things that are very like high in chemicals, um, certain scents around the house, air fresheners, products you're using, like memory foam, believe it or not, is actually full of toxins, and a lot of people use that to sleep
Mm.
on, whether it's their mattress or their pillow. So these kinds of things are going to trigger a stress response, whether it's on the skin, whether it's from inhaling and breathing it in. So changing a lot of things at home, like I don't, I've changed all my toxic, like cookware. I don't
Mm,
use plastic containers
nice.
anymore. It's always glass.
Yeah, same with us.
I make sure like dishwasher pods, there's no chemicals in those. Laundry detergent, like you're wearing this stuff. Cologne, I've stopped spraying cologne on my skin. I spray it on my clothes because that can also and like penetrate through the skin. There's a lot of things that we can lower the toxic load on the body, and I think that has a very, very, very high impact on helping the stress response decrease in the body and ultimately helping the vagus nerve function a little bit better. The more you can take stress away from the body, the more space you give for improving the vagus nerve. If
Mm,
you're doing all of these things to try to improve the vagus nerve, but the stress response is
yeah.
just so strong, none of these things will work. I think
Hmm.
like the best analogy is you cannot add more water to a full water bottle. Like you need to
Yeah.
remove water first to add more water. So I
Yeah.
think you need to focus, and a lot of what I focus on with my patients is not actually adding more things to their day to day. It's
Right.
actually removing things,
Right.
taking away the things that
Yeah,
are
you can
negatively affecting.
probably make a much bigger impact much more quickly just by doing that piece of it.
Yeah, and then focus on adding those things.
Yeah. Yeah, I think that that's actually that's great advice. Sometimes it's easier to just identify those things than creating the new habits.
Yeah, and
So
it's
it's a good
also,
starting point.
people that are also very overwhelmed, the last thing they want is more to do.
Hmm.
Like I think if you can kind of reframe it as like, look, we're actually going to start just focusing on removing things. And they're
Hmm.
like, okay, like now there's less going on up here, and it's like it's easier to focus on things and be a little bit more clear.
Yeah. Yeah, I love it. All right. I think that that wraps up our time here.
Awesome.
And this was a great conversation. We definitely have to do this again. We'll pick another topic, do something different. But
Yeah, hopefully not a year later. We'll
yeah, I know.
plan something a little sooner.
Yeah. Well, this is a good way to kick it off. But yeah, Brendan, thanks a lot for joining me. Thanks for sharing all that valuable knowledge. And we'll do it again sometime.
Awesome. Thanks for having me. It's been a pleasure.
Yeah, absolutely. Have a good day.
Thanks. You too. Hope you guys learned a little bit. Take care.
Thanks everybody for joining.
Thanks. Bye.